Good evening. I'm very happy to be here among all those amazing people who really want to change the life of people with diabetes around the world. I know the program that I'm about to show you that we've created with Jocelyn Diabetes Center has changed a life of a person who's very dear to my heart, my sister. She was discovered to have diabetes and her 20 years old. It was type 1. She was a nursing student back then. It really changed her thinking, so she shifted her career from a nursing to be a diabetes educator. Her name is Dua, and my name is Sara Al-Turkestani. I'm from Nahdi Medical Company, and whatever program that I'm going to show you here is designed by Nahdi Medical Company in collaboration with Jocelyn Diabetes Center. Photography are allowed, so feel free to take any photos. And please note that this is a program evaluation. The aim of this program was to demonstrate the retail community pharmacists could really successfully recruit, engage, and counsel people with diabetes by serving as a trusted source of diabetes information. So I'm just going to give you a little bit of a background about diabetes in Saudi Arabia. The prevalence of diabetes in adult, it's 18.5% in Saudi Arabia, so it's a little bit higher than Mexico. And when it comes to Saudi Arabia, the number 2 cause of death in Saudi is diabetes after car injuries. So this is a very serious issue that is taking place around Saudi. And the reason behind this, especially for type 2, is the lifestyle of the Saudis. So basically, it's a very sedentary lifestyle. Because of the weather, a lot of people, they're just taking their cars, there's no enough sports, and eating habits is not very well. The government have started to take a look at this very seriously. So, but what 2030 strategy of Saudi Arabia, they decided to look at to promote physical and psychological well-being very carefully. So I can start to see a lot of changes towards that. The Saudi Food and Drug Administration has forced restaurants to have, for example, calories intake next to the meals that they're taking. The governments and the cities started to have recreation area and sport areas for people to walk and exercise. And there's a lot of laws has changed towards having female gyms. So 2 years ago, it was very difficult for a female to open her own gym. Today, things have changed very positively. In the school system, also things are changing. So I'm really happy with those positive changes that are taking place in Saudi. But the same problem goes with every single country, especially third world countries, where they don't have enough health educators who are specialized in diabetes. I'm not talking about endocrinologists, I'm talking especially about diabetes educators. So when we met doctors at the beginning of the program, we've noticed that doctors in Saudi Arabia, they only spend 5 to 10 minutes with people with diabetes. This is not enough. Some of them are newly diagnosed. So there's no enough education about diabetes in Saudi Arabia. So Nahdi Medical Company, which is a big pharmacy chain, it's like CVS in US, decided to look at this seriously and said, okay, let's use our pharmacists to be diabetes educators. They are health professional, they are available, they have less waiting traffic and less waiting time, they're cost effective. And of course, there is a high reach of pharmacies in Saudi Arabia. At Nahdi, Nahdi has 1,400 pharmacies, and they're 5 minutes away from 90% of the population. So this is a great chance to use the pharmacists to be in health educators. So, but pharmacy back then, like 5 years ago, did not know anything about diabetes. So they collaborated with Jocelyn Diabetes Center to establish this program from the scratch to help people with diabetes under the umbrella of the Ministry of Health. So everything was designed with the collaboration of Jocelyn, and we also, with the help of Jocelyn, we've reached the stakeholders of diabetes in Saudi Arabia and asked for their help to design this program. So the methodology about this program evaluation started with the proof of concept in 2014. So it has 5 stages. We have the recruitment stage, the enrollment stage, the implementation of the session, one-to-one session, the results, and the evaluation. This is how something called health resource centers inside the pharmacy looked like back then. Then after developing of this project a lot, this is how it looks like right now. We started with 11 locations with 25 pharmacists, but today we have 44 locations with more than 50 pharmacists. Those pharmacists, we like to call them diabetes consultant pharmacists. They are specialized in diabetes. They don't do anything but educating people. So they don't work behind the counter. They're focusing 100% with the people to to educate them about diabetes. They have one-to-one session with those people, and I'm very proud and happy to say that last year we hired the first female pharmacist. It was very difficult to have female pharmacists back then, but things has changed positively. So those DCPs, or diabetes consultant pharmacists, they got an online training, they got diabetes certificate with 90 to 170 hours of training to be certified diabetes educators, and they had 3-day live training with Joslin Diabetes Center, teaching them about the program that we've designed, which is called Let's Talk About Diabetes. Let's Talk About Diabetes, it's a booklet. This booklet has 4 sessions. Those 4 sessions are the medication, so the pharmacist discussed the medication with the patient, their lab test, the blood glucose monitoring, and the doctor visit. The reason we decided to go with those 4 sessions is because with the research that we've done at the beginning of the program, we've noticed those are the 4 problems that the patients with diabetes are facing in Saudi Arabia. So the session lasts from 20 minutes to 1 hour. It depends on the time of the patient. It has 1 to 3 weeks interval from 2 to 4 months period. The program evaluation endpoints started with the enrollment, the adherence to the medication, the clinical outcomes, especially the hemoglobin A1C, the blood glucose monitoring, the awareness, and satisfaction. Everything was collected through e-forms that was designed by Jocelyn. So those are designed by Jocelyn, translated to Arabic to make sure that it fits our culture. And then all the information are being collected there with different forms. The forms collected the basic demographic, the loyalty card number for those patients, because we can track their medication adherence and everything else, and the baseline and follow-up result for the biomarkers, the medication list, the diabetes knowledge, attitudes, and belief, and the diabetes distress scales as well. So the inclusion criteria is for people over 17 years old, type 1 and type 2 diabetes, the exclusion for gestational diabetes, women only with history of gestational diabetes, and caregiver of people with diabetes. So we are actually accepting everyone, but in this study, we don't have the everyone's data. The participation selection, it has like 4 years period. The program enrollment, we have 49,000 customers were being approached, 12,515 they're being enrolled and took the 4 sessions, and 5,150 completed the post-program. And we have 84% of them are male. The reason behind this is because women driving was not yet approved in Saudi, so a lot of our visitors, they were male. Plus, a lot of female, they feel not very comfortable talking to a male pharmacist, but now we're actually hiring more females into the pharmacy. We have 48% of people visited us, they did not know that they do not know their type of diabetes. So there's a huge gap of knowledge there. So let's talk about the results. I'm going to focus here a lot on the hemoglobin A1C biomarkers. So we have 3,681 reported their baseline hemoglobin A1C, and the paired A1C was for 2,066 people. There was a significant drop of A1C from 8.5 to 7.6 just by education. Pharmacists are not allowed to change their medication, the medication of the patient. So imagine how education can really change a life for people with diabetes. So there's a shift in the proportion of individual meeting the target HbA1c below 7 from 22% at baseline to 37% at follow-up. And the hemoglobin A1C awareness has increased. So participants who could not recall correctly their A1C improved from 19.4% to 51.7%. There was an improvement in the awareness as well. Also, the medication adherence has improved. So 23% reported that they may have they are not adhere to their medication. After the follow-up survey, we've noticed that this has dropped to 3.3%, which is a significant number. Also, the diet and exercise has improved. So improvement in the reporting using diet and meal plan was 4.6%, that increased to 39.7%. Same thing with exercise. It was 3.5% at the baseline and 35% at the follow-up, according to the survey. One of the key reasons that actually helped improving the result of diet and exercise, that we added another service to the clinic, which is the weight management service. So when you look at the pictures, there's a scale. This is a very expensive scale. Usually, the dietitian charge for this 100 riyal, which is almost $25. So we're not charging anything for that. We're asking people to step up on the scale, and we designed for them a meal plan that was designed by nutritionists. So it can really help for people with diabetes and other people who are really wants to take care of their health. So what I can say that because of this program, the delivering of diabetes education in Saudi Arabia has changed a little bit. So, and we noticed that when I asked the patients in the survey if there is an improvement in their way of looking at the clinical pharmacist. So there was a huge and significant improvement of how they look at the pharmacist as trusted source of information. And when we asked them about, let's talk about diabetes program, and if they really liked it, there was a very positive feedback on this as well. So at the end, in summary, what I can say that retail community pharmacists could successfully recruit, engage, and counsel people with diabetes and being a trusted source of diabetes information and part of the integrated healthcare system. I think one of the key strengths of having a pharmacy or a chain of pharmacies work on that is the scalability. So we can work from 11 stores to 50 stores to 100 stores or maybe 1,000 stores. This is very scalable. It's very cost effective to hire a pharmacist to do such a thing. And it has a high engagement ability with the community through loyalty programs, through marketing campaign and all those things. So I get to enjoy using all the marketing tools to communicate and engage with the people with diabetes in our program. So the weaknesses for this program evaluation, I think it's the small percentage of the paired HbA1c related to the self-reporting, because we cannot measure the hemoglobin A1c inside the pharmacy, so we ask people to bring us those results. But we're working right now with a third party. It's lab agencies to go and incentivize the patient to go and measure their A1C at the lab agency so we can get the results from there. The female percentage is lower than male, but we're solving this issue now by hiring more female diabetes consultant pharmacists into the group. And we have limited number of stores at this stage, so we're trying to solve that. Today we have more pharmacists who had the diabetes education certificate. So from the 23 now we have 111 diabetes trained pharmacists who are ready to work and in the next expansion. So just to remind you, we started with 4, then 11. Today we have 44 health resource centers around 20 cities in Saudi Arabia. And our goal by 2020 is to reach 100 health resource centers in more than 30 cities around Saudi Arabia. Thank you very much.
Is there a fee for the visit, for the education, or is that part of, as the patient comes in to fill out the prescription, the information is provided?
I really love this question. I forgot to tell you, this project was designed from the beginning to be for free. The reason we felt that we wanted to do something for the community, it's a CSR project. When we designed this project, we did not have any financial intention behind it, but I can tell you that the loyalty of those people who are coming to our stores has increased, and sometimes I peek to their basket size and I notice that it's increased because of their loyalty towards the brand or the company.
Hi, Diana Isaacs, Cleveland Clinic. Great presentation. I am also a pharmacist, so I especially appreciate it. You mentioned that it's cost effective. I'm just curious how pharmacists are paid or who's supporting their salaries, especially since now instead of dispensing medications, now they're doing this diabetes education. So I was curious about that. And then just also curious about kind of the physician response to this and how their outlook on the program.
So when I said cost effective, I meant for the patient, not for the company, because it's costing the company a lot of money and resources towards that. That's why the progress of expansion is slower than what I wanted. The reason, when we started this program, the economy in Saudi was perfect. So I had no concern about the expansion by any means. But today, with the changes in the economy, we are taking the expansion wisely and slowly. we're trying to work with the company, with the finance team, with the commercial team to see how we can expand this without having a high cost on us. So the highest cost comes from the salary of the pharmacist, not the location itself, because usually they're not actually selling any medication. So there is no ROI of having them they're working there. Regarding the doctors, we were very afraid of the reaction of the doctors, especially that in Saudi Arabia, we're a very hospital-centric country. So the doctor is everything. Having the pharmacist being involved, we were very afraid of the risk, but we did something very smart with Jocelyn. We brought the key stakeholder of diabetes, the doctors, the endocrinologist, into one room. And we asked them how we can contribute as a pharmacy, what are the do's and don'ts. So one of the biggest don'ts was do not change the dose or the medication of the patient. So we took that seriously under the supervision of the Ministry of Health. So our role is purely educational. There is no change in doses or anything. We would like to have more collaboration with the doctors, but this is a concept that does not exist in Saudi. So there is no relationship between a retail pharmacy and a doctor by any means, except for the booklet that we've designed for the patient to take it to their doctor and discuss their case. Any questions? Thank you very much.